Assalamu alaikum. The communication day. The scenario: patient, 37 years old man with gonorrhea, and your task is not to tell his wife about, or he requests not to tell his wife about the diagnosis. The details of the scenario: 37 years old man. He was admitted 2 days ago with 3-day history of fever and joint pain and skin rash. He described the joint pains as migratory, mainly involving the hands and knuckles, knees, and ankles. Skin rash was present over the forearm. System inquiry was entirely unremarkable. He is a drinker of alcohol, 2 glasses during the weekends, but doesn't smoke and doesn't use recreational drugs. He had short holiday to Thailand with two of his school friends, and he returned home 3 days prior to the onset of his illness. He denied having sexual intercourse with anyone other than his wife. I think the rest of the scenario explaining
Okay.
lab. The admission reported showing gram-negative diplococci in pairs identified Neisseria gonorrhea. Your task is to discuss the result of blood culture and the next steps with him. You are the medical registrar on the ward. You haven't met him before as he was transferred to your ward from the acute medical unit only this morning. So we can start right now. Are you ready?
Yes, ready.
Okay, here you go.
Hello, I'm Dr. Ala. I'm one of the doctors in the ward today. Is this Mr. Ahmed?
Okay, yes, Mr. Ahmed. I'm Ahmed.
Yes, nice to meet you, Mr. Ahmed. So we are meeting today to discuss your recent problem. Can you tell me more about that?
Doctor, uh, 3 days before, sorry, 1 week before, I visited Thailand with my two friends. And when I came back 2 days before, I developed fever, some joint pain, and rash. I do not know why I'm having this problem. Can you explain me?
I'm sorry, I don't hear well.
What,
Doctor, 1 week
anything
before I
happened?
visited Thailand with my friend, with my two friends, and I stayed there 3 days. And 2 days before I came back, when I came back after 2 days, I was started having fever, joint pain, and rash. I do not know what is the reason why I'm having so much severe pain in my joints. Can you tell me what is going on with me?
Well, I'm sorry. Well, I'm sorry to hear that, Mr. Ahmed. Well, we have done some investigations for you, and it has been released. But I'm sorry to tell you that they are not as we hope.
What do you mean by that the reports are not as good as we were hoping? What do you mean? It is a cancer?
No, Mr. Ahmed. The results of your investigation have been released, and we see that you have infection in your blood
Where is the infection?
that
Where
causing
is
your symptoms.
where is I
Yes,
have
infection in your blood. Can you hear me?
Yes, 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 I'm hearing you.
Okay, we found a bug called gonococcus in your blood,
Okay.
and this explains your symptoms of fever and joint pain. And we will start you on antibiotics that will help you treat this infection.
Doctor, why are you starting an antibiotic? I'm just having simple fever and joint pain and some rash. So just give me some painkiller. Why you want to start antibiotics? Because I have heard about the antibiotics that they are that the antibiotics have many side effects.
Yes, I appreciate your concern, but in your case, we have confirmed our diagnosis, and it is properly treated with antibiotic. Painkillers alone will not clear your infection.
Okay. So
Okay. Okay. There is another thing that is relatively sensitive. I want to address with you. Is that okay?
yes.
Well, gonococcus infection, it is transmitted from one person to another by sexual intercourse. I
Okay,
hope
doctor.
you don't. I hope you don't mind if I ask you some sensitive questions.
Okay. Okay, carry on.
I'm sorry, I didn't hear.
Okay. Okay, carry on.
Okay, I know you told the other doctor that you didn't have any sexual intercourse with anyone other than your wife, but I wanted to review the details once again with you. Is that okay?
It's okay.
So, uh, in your trip, did you have any uh, sexual intercourse that you are afraid to say to me?
No, no, no. Except my wife, I did not have any any sexual intercourse.
Okay. Mr. Ahmed, we are here not to judge you. We are here to help you. So if there is anything you can tell me, I can help you better.
Doctor, I have heard about this bug, that this is a very dangerous bug. I am surprised from where I get this bug, because I am only limited to my wife. I am not having any extramarital relationship. So from where I get this bug?
Well, I'm sorry to tell you that the only way that bug is transmitted is from one person to another is by sexual intercourse.
So you mean to say that I got it from my wife?
No, I'm asking you if you have any other relationship.
No, no, I don't have. I told you I don't have.
Okay. So in this case, you should uh, ask your wife to do the same test. Is that okay?
No, no, doctor, please don't tell my wife. If you will inform my wife, uh, she will also having the same thing, that I am having some extramarital affairs with some other female. So please do not tell my wife. It will be a big problem for me.
Well, I appreciate your concern, but uh, your wife should know because if she is positive too, we can offer treatment.
But I know if I will tell him, he will be very angry with you. I don't want to tell him. You should, okay, if you want to give me medicine, give me medicine. I will take that medicine. So that I must be clear from this bug. Please don't tell my wife.
Well, I'm sorry to tell you that, Mr. Ahmed, but if she is having the disease and she is not treated, she is gonna have complications of this disease.
Can you tell me what sort of complications can result if she will not treat?
Well, she can have some fever and some problem in passing urine, and in severe cases, it can affect her fertility in the future.
Okay, okay. So, so So for me, it is very difficult to tell her. So give me some solution. How can I tell her?
Well, we can offer you a counselor to guide you on how to gently break news to her. Is that okay?
Okay. Then,
But
okay, carry on.
okay, so it is better she hear from you. But I am afraid that if we feel that the partner is likely to suffer harm, we cannot keep this information confidential anymore.
Okay.
Is that okay?
Okay, is that okay? Okay, you will give me counselor and he will advise me how can I inform my wife about my problem. Okay, anything
Okay.
else you can do for me?
2 minutes left.
Yes, we will start you the antibiotics that will help treat your infection. Other than informing your partner so she can be tested and treated, nothing else. No. Do you have any other concern?
Doctor, can I have a sex with my wife right now?
Well, in this case, we prefer to wait till we clear the infection.
Okay, it will take how many days?
Well, gonorrhea is treated by a single dose of antibiotic that you're gonna have it by injection, and after a few days or maybe a week, you can resume your sexual activity again, but after also your wife is tested and treated.
Okay, can I continue with my job?
Yes, you can continue with your job whenever you are, provided you are okay and don't have too much symptoms.
I'm working in the sexual behavior counselor team. So should I continue my job?
Working with what?
Sexual counselor.
Mm.
Okay, time is up mostly. Thank you, Dr. Azar. Very nice scenario. And you act also professionally. Although you read the message later, right? You read the
Yes,
message
yes.
later. Yeah. Okay. Well done. So you can comment. Well done, Dr. Ala, by the way. You can comment on Dr. Ala first, then I will comment, okay?
Then two, three things I noted. He did not mention my age. My age was 37 years. I think he forget to mention. And then he did not ask my job because my job was very important. I was working as a sexual counselor. Then I was asking him from where I get this infection because I don't have any extramarital relationship. So I cannot get a clear reply of this on my question.
Yeah.
Now you can comment.
Yeah, I will comment now. So as you said that introduction was missing the details of the patient's age. And I advised before any scenario with sensitive issue, you have to assure the confidentiality from the start. If even after introducing yourself, I am doctor, you are the patient and the age, I want to reassure you before further moving on that this meeting will be confidential between me and you. Unless something will harm you, we might break the confidentiality, or you permit or you give us a permission to breach the confidentiality. That time we can do so. So if you reassure him from the start, he will be calm during the conversation. Any secret he will tell you, anything missing or sensitive he can tell you with volunteer. But the way you ask about history, it's not allowed in the scenario, especially the communication, I mean. This is what I think. So you don't have to take sexual history from him. If you want, you can tell him, sorry, I'm afraid to say this bug comes only by sexual intercourse. That's it. And if he see or if he feel like very calm to talk to you, he will say it honestly that I had yes contact with. But to ask him, did you have any contact with any uh, extramarital or casual relationships? This is in the communication scenario is not preferred. Might harm you in the mark. So better to say, Mr. Ahmed or whosoever, Mr. X, this bug comes only with sexual contact with some patient having this bug in his private area. Since you don't have or you don't have or you don't have this infection in your home, so it might be from other relationships, which is casual relationships. So I am afraid to say you got it from outside your home. If he denied again, you can repeat it and reassure that everything will be confidential. But to ask him clearly, did you have any sexual contact with others? It will be considered like history taking and it will harm the mark. This is my opinion. Apart from this, you address everything well, the management, the clinical judgment point of view. You will take a medication and for how long? Again, don't give clear cut off the period of, for example, resuming the sex. We are here to discuss and to reassess you again. If you are able to, we will let you do, or we will let you know. Okay? But you mentioned 1 week. I don't know if it is enough to take one injection of medicine and he will be clear of this infection. I am not sure. If anyone has,
I don't know to.
yeah, so don't mention 1 week. Why you mention 1 week? He might still have this infection. If you don't know, Dr. Ala, don't mention it.
I
The
Okay.
think we
problem
can
here
say
is that the wife, you should treat both at the same time because,
Yes, if
um,
he had contact with his wife, of course,
yes,
he
and
should.
when he asked, I will not tell my wife. The problem here that you will tell him, your wife has the infection, and if you treat it, you will get the infection again. I think you will not reach a confidentiality because it is not like life-saving or something like that. We will encourage and we will support like that, but I think the sentence that you will breach the confidentiality if he will not tell the wife, I think not true. Uh, and there is other thing if in this scenario he like um, that he will said give me the treatment for her and I'll and tell her this is treatment for anything else or she has
Hmm.
any yeah there is a concern raised before in other like
Yeah.
this scenario.
Yes.
Uh, at this time, you should refuse because
Of
the
course.
patient
Yes.
has, yes, the autonomy, the right to know what is wrong with him and what is this
Yeah.
medication for.
Yes, I agree. Yes. So this is another concern, yeah, can be raised, and the answer, as Dr. Aisha said, I'm sorry, I'm afraid to say, yeah, she should know what she's taking for. Okay,
Yes, but
and
Yes.
about breach the confidentiality, I don't know if anyone has
no,
information
no, no,
because,
we will not
yeah,
force. Yeah, we will not
yes.
force. We will tell him, as Dr. Ala said, we can counsel someone to talk to your wife, and he can or she can tell her about what's happening or what's ongoing. If you don't
Mhm.
mind, if you can tell her, it would be much
And
better.
we can not judge also about this only transferred by because it may be transferred from wife also. Although the scenario is clearly said that he is come from Thailand and this is appear after the travel, but you will not judge like I'm afraid to say that this is you
But
should
don't be
tell
also
me or
judge. Yeah, but
yes,
don't be
just
judgmental on his wife.
yes, you can give
How
as information. This is only transferred by sexual contact
exactly? Yes.
but not force him to admit something. Yeah.
No, it's not force. It's the clear scenario. Dr. Ala told me the details about this scenario. He had a contact, sexual contact, but he want to deny or he want to hide it.
Like
So
the suicide, you will make
yes,
him
so
reassured
yeah,
that you will not tell anyone, and
exactly,
yes.
exactly. After first trial of talk and questioning him, no, but not question. You can't say the sentence that everything will be confidential. If he's tried to open and to relax and to open the discussion about it, it's okay. If not, you can convince him again. This is confidential, as we have discussed earlier. So please share with me your ideas. We are here to treat you. Reassure him everything will be confidential. And if anything, also you want to deliver, we have the way to deliver this message or this news to your partner without harming her and also without harming you.
You are right, yes.
Yeah. So this is the
Yeah.
way. But
بس
yes,
Very
Dr.
nice,
Ala, go ahead.
very nice.
about breaching confidentiality, yes, you can breach confidentiality in this case if he refused to tell his wife.
Exactly. Yes, exactly. If he refused after two
Yeah.
trial, first trial, please tell her. If he said no,
You
doctor,
try
I cannot.
to convince him first, then if he
Exactly.
is still refusing, you can break that. And but first you will inform him that you are going to tell her.
Exactly. But before that, also you can offer a meeting or co-meeting with someone who can sit with you to deliver this news gently without harming her, and we
Yeah.
can.
Breaching confidentiality is a last result or
Yes,
last
by
option.
force, or yeah, if you want to like by force, so it will be the last option. But before that, you have to convince him. If he refuse, you can convince him with a meeting with our consultant or someone who can deliver this without harming the relationship between you and your wife. And if not, if he's still refusing, I'm so sorry to say, and I'm afraid to say, we might tell your wife that because she has the right to know that. Although you can
Yeah.
say also before that, we can send her a message as anonymous that she had contact with someone having this infection, so we want to test you. But I guess it's not in this scenario because this one means only sexual contact, not any contact by any route, not
Yes,
like
another point.
HIV, for example. Yes.
Another point, but there was no time. There should be also a screening for HIV and other sexually transmitted disease.
For him.
Yes.
Yes, yes, you are right. You are right. It should be.
Okay.
And
So it
and
should be
and
raised.
then
Yes.
for the first time, if I refuse that I did not have any extra any casual relationship, again you can, as Dr. Basam told, just Mr. Ahmed, everything will remain confidential.
Mhm.
And if there do you have any casual relationship, so that we can treat you in a proper way, I think.
But without asking the question, do you have its taking history?
Yes, you are
So
right, Dr. Bekman.
yeah. So what you will do, you will tell him, uh, logic by logic or scientifically, this bug comes only by sexual contact, and we are always warning our patient about the dangers and the risk of this bug and how it was transferred. He will feel like he wants to tell you about it. Okay? He will be convinced by this way. But if you ask him, he will hide again. Please tell me, do you have? Of course, he will say, no, I didn't have. If you reassure him that everything will be confidential and the seriousness of the condition, and we should give you a medicine, and hopefully that this medicine, if you received it, you will be cleared from the infection. And even if you have contact with your wife, we reassure you that she will be treated with this infection. He will be reassured that then he can open up everything with you, details of what have he had in the trip, and he will tell you everything about his secrets. This is my opinion. So better to start like this, okay? Reassure and tell him everything will be confidential, and we are here to reassure you that everything will be fine, you will be treated, and if even you have contact with your wife, so yeah, she will be treated as well. And if you want us to tell her about what's ongoing, we can have a meeting with your wife because this thing is too much sensitive, I know, but no worries. She should know, and we're also here to support you. Simply, okay?
Okay.
Anything else, Dr. Azhar, you want to say?
Now regarding the treatment, Dr. Ahmed told, Dr. Allah told that you will be clear after 1 week. You can say like this, we will give you treatment, and after completing your treatment, our consultant, our team will reassess you, and then we will see whether you are clear from the infection and or not. Then you can have a sexual relationship with your wife. I think he can say like this.
Oh,
Yes, you are right, Dr. Azhar.
okay. So any comment from others? Let's read the comments. But before reading the comment, I want to check for notifiable disease. I guess the gonorrhea, one of the notifiable, right?
All is STD notified.
Yes, I think so.
Yeah,
Someone
yeah,
else?
it's
Yeah.
as I told you, rinse, reassurance, isolation. Here we will not do the isolation, notifiable disease, and S means screening of the contacts.
Mhm. So we will inform specialized team about this because it's one of the notifiable disease. We should notify about it, and he have to take care of the others. I mean the other contacts with you. Okay, so it's notifiable, Dr. Iman. Case data are available for national notifiable sexual transmitted disease, including chancroid, chlamydia, gonorrhea, and syphilis. Yes. Send him to the genitourinary medicine, screen for other sexual transmitted disease. There is office, they call your wife without she know. Good idea. So it's like the same HIV point. Anonymous clinic. We will contact your wife to tell her that she has a contact with someone have infection we want to test you about. But if he is agree, it will be much better to be reassuring after receiving her medication. You can also tell the suggestion your wife to do the test. If it is negative, no need to tell her about the patient condition, and if he takes precaution, it will be all right. Is it possible in this way? Yes. Very nice idea, Dr. Fazlullah. So we can test her if she doesn't have. So we can mention like we have suspicion about a disease. It's a good idea, but I don't know if it come positive, so she will know. Better to say, yeah, we will test you because your husband, for example, if of course if the details reach to this level, but it will not reach to the extent of what to tell my wife and how to tell her. It's not our job here. Our task is to sit with him to confirm and to reassure and to ask him to ask his wife to be tested. But how and what is the way? It's a good idea, but I don't think we can go deep to this level. He might have contracted the infection from asymptomatic wife, so we should stick to this scenario, I think. Yeah, we have to stick to the scenario, but again, I asked Dr. Ala about what's hidden in the scenario, and he told me yes, he had a sexual contact in the trip in his journey. So it's clear he got it from outside, not from the wife. Okay. Okay, let's move to the next scenario, Dr. Azhar.
Yes, I have posted
This
in
is
the group.
yeah, so I will get it now. Thank you, Dr. Ala. Very nice scenario. By the
Yes,
way,
it
I
was
want,
very.
yeah, very nice scenario. I want to reassure everyone here. Anyone has practiced a scenario in any meeting and he faced the scenario in the exam, he will just do it what he experienced with us, with the correction of the information, of course. I mean, you will be too much confident while talking. Other way, if you face a scenario for the first time in your phases in the exam, you will be mentally blocked. What I will do, what I will say, how he will face this question, how he will answer. But if you practice the scenario with any meeting with us or apart from our meeting, any scenario you practice during your training, much better and it will be much easy for you to practice it in the exam. Believe me. So try to practice as much as you can because it will be helpful for you and helpful for us. Suppose today we are at 5 minutes before the meeting, but no one want to practice the communication. Again, it's your time to practice because the scenario will have practice it with us, might have it in the exam, and easily you can practice it with too much confidence. Okay. Okay, I'm sending the scenario now. You can read it, Dr. Ala. You will be the surrogate now, the opposite. So Dr. Azhar will practice the scenario he gave to you.
Okay,
So
okay.
Mr. Thomas, 35 years old man who presented to the hospital 2 weeks ago with generalized swelling edema, foamy urine, and fatigue. Initial investigation revealed massive proteinuria, urine protein more than 3.5 grams per day. So, and hypoalbuminemia, hyperlipidemia, suggestive of nephrotic syndrome. A renal biopsy was performed, and the result confirmed minimal change disease as the cause. The consultant has asked you to break the news to the patient about the diagnosis, explain the treatment plan, and address any concern he may have. Your task to explain the diagnosis to the patient and also explain the treatment prognosis, the need for long-term follow-up, address any concern raised by him. Very nice scenario, Dr. Azhar. It's new one and
Yes.
also something to refresh our
Yes,
knowledge and
it appears in the recent diet.
yes, I know. It appeared, I think, I don't know, overseas or UK. Anyway, it's nice scenario to practice it because it's a new one. So be ready, Dr. Ala.
I'm
If you're
ready.
ready, okay. Are
Okay,
you
can
ready,
we start?
Dr.? Yeah, sure. Here you go.
Hello, I'm Dr. Azhar, one of the doctor in the kidney ward. Are you Mr. Thomas, 35 years old?
Yes, I am. Welcome, doctor.
Okay, today we had to discuss the results of your problem. Is that okay with you?
Yes, that's okay.
Before I start, do you want to accompany anyone to attend this meeting?
No, I'm fine.
Okay, thank you. Okay, before I start, I just want to know how much do you know about your problem so that both of us, we should be on the same page.
Okay, doctor. Yes, I have that swelling all over my body since 2 weeks, and I feel fatigued all the time. I don't know what is wrong with me.
Okay, Mr. Thomas, I can understand your situation. Uh, the results of your uh, problem, it is in my hand, and it is not as good as we were hoping.
What you are mean, doctor? Is it serious?
Doctor, before you presented with the problem of swelling of your body and foamy urine and fatigue, and when you were admitted about these problem, our consultant decided to go for a snip test of your kidney. When we did the snip test, the results are not good.
Yes, what it revealed. I wanted to know.
Okay, okay. The results are showing that you have problem in your kidney, which we call in our languages minimal change disease. Do you know about this? Or do you want me
Mm,
to explain more
No,
about this?
no, I don't understand what is this.
Okay. I will show. I will draw for you. You see, this is
Okay.
our kidney, and here there are some filtering points which we call in our languages the podocytes. These are the some special cells. The function of these cells is that that they are secreting the fluid and preserving the proteins from going into the kidney to your water work. So your kidney, these cells have been damaged. That's why they are leaking more proteins through these cells, and these cells, they are coming in your water work, and that's why less amount of the proteins are present in your blood. And when there's a less amount of the proteins in your blood, and uh, due to this problem, your body is facing, your body is swelling up, you are having edema in most of your body parts, especially it is on your legs or on your face. And beside this, you are also having, you may also having foamy urine. If you pass the urine, it will be foamy, and you will also be tired and fatigued. Are you with me?
Yes, I am with you.
Okay, so what we will do, our consultant has decided that since these cells, they are working not normally, so what we will do, we will start a medicine which we call in our language is steroid. Do you know, do you have ever heard about the steroid?
Yes, I heard a lot of side effects of steroids. Will I suffer them?
Hello.
Yes, I'm here.
Okay. Okay, then you see, we will start the steroid. This is a medicine. It will decrease the soreness in your kidney, because due to the soreness, these special cells which I told you, podocyte, they are not functioning normally. Normally, their function is that they will do not allow the proteins to be filtered. So when they are sore, they are not functioning properly. So to decrease this soreness, our consultant has decided that we will give you a special medicine which we call steroid, and and due to this medicine, your soreness will be slowly will be finished, and you will have a normal life. Do you have? Are you with me?
Yes, I am with you. But how long will I be on steroid?
I cannot give you any exact time. We will monitor you minutes by minutes. Our all team consultant will be with you, and we will monitor you daily on daily basis. And then our consultant will decide about about your problem. But the good thing about this problem is that it has a very good outcome, and most of the patients, they recover fully after the proper treatment. Is that okay with you?
Yes, that's okay. But doctor, I have heard a lot of side effects caused by steroids. Is there any other alternative?
Okay, there are many alternatives, but in your best interest, our consultant decided that this medicine is best for you. I know there are many side effects. After weighing the benefits and risks, they have decided that we will start this treatment for your problem. Is that okay with you?
Yes, that's okay. So
So,
doctor,
yeah, just
from where I got this disease?
you see, this is what we call our defense system. There's our defense system. Normally this defense system is attacking our bugs which are present in our body. By mistakenly, this defense system, by mistakenly, it has affected your kidney, and due to this mal-directed defense system, your kidney has been affected, and that's why you are having this problem. And what the steroid will do, they will decrease down the this defense system, so that you can have a normal kidney, and your sign symptoms will be decreased after some proper time of treatment. Is that okay with you?
Yes, that seems fine.
I also want to inform you that this kind of disease, it has a very good outcome, and mostly the patients, they are recovered very well. And there are few patients in which there are relapses, but we will keep you under continuous follow up, so that you cannot have this problem in future. Is that okay with you?
Yes, that's okay. But doctor, when will I get back to work? I cannot work with my body falling of water.
Okay. What is your job?
I'm a teacher.
What do you do? Teacher. Okay. Our consultant, they will assess you, and after assessing your condition, they will, no, we will update you about your condition. Is that okay with you?
Yes, that's fine. But I want a time frame for my condition. Is that possible?
Mr. Thomas, at this time, I cannot give you the exact time frame, but reassure you that our consultant, our whole team will be with you, and they will assess you on daily basis, and whatever will be the update, we will inform you. Is that okay with you?
Yes, that's okay.
And may I ask you some more questions?
Yes, please.
Do you smoke?
Yes, I smoke.
And how many cigarettes for how long?
Not too much, about 10 cigarettes per day for the last 10 years.
Mr. Thomas, any amount of the cigarette is injurious for your health. So it's better if you will stop it. If you are willing, I can refer you to the smoking cessation clinic. Is that okay with you?
Yes, that would be fine. Thank you, doctor.
1
Do
minute
you
left.
drink alcohol?
No, I don't drink alcohol.
Okay. Do you any other sport from us?
What?
Do you, any financial issues? Any other sport do you want from us?
Yes, so my job will be affected and I will be financially having problems.
Okay, we will involve social worker and occupational health worker so that they can help you in this regard. Is that okay?
Yes, that's okay, doctor. Thank you.
Okay, do you have any other concern?
No, I think you covered everything. Thank you, doctor.
Okay, we will give you leaflets, brochures, and so that where everything about your problem will be there and you can read it. And if your symptoms come back like your swelling and your foamy urine, fatigue, any problem with your whatever, you can come anytime to the hospital. We are at your service. Is that okay with you?
Yes, that's okay.
Okay, thank you very much.
Thank you.
Okay, time is up. You can comment now.
Well, Dr. Azhar, you gave a lot of information when you was explaining that the disease. They call it suffocating information.
Okay, then next.
The next, you didn't mention about admission. Is that condition can be treated at home? I don't know. I think it need admission.
Yes, we will admit. Yes, we will admit you.
Yes. No other comments. You did great.
Thank you. Yes, Dr.
Yes,
Qasim.
well done, Dr. Azhar. MashaAllah, MashaAllah. You explained even the drawing, although it's not clear, but yeah, you went deep to the level of the cells. However, you explained the role of the cell, the leaking of protein. That's why. But you said edema? No, no, not edema. You said a jargon.
Swelling.
What is? Yeah, it's supposed to say yeah swelling, but you didn't say swelling. You said edema, I think. Yeah, you said edema,
Yes, I
which is
said edema.
yeah, it's jargon. So better say yeah, swelling around your eyes, swelling around your legs, in the feet. Yeah, I think. But apart from this, you did great. The steroid also you mentioned the most common complication. And to be more also clear about the complication, you can say you cannot cover all complication of steroid. So the best way
Yes,
you can tell him, I will
yes,
provide you leaflet before about the steroid side effect. It has or it carry a lot of complication, which you have to know about and how to protect yourself from everyone. And we have a group, we can sit with you to tell you more about the precaution, what to take, what to avoid, along with the dietitian, of course, because the dietitian can help you to take proper diet in order not to gain more weight. This is, I think, what's on the
Yes, and
lesson.
the case,
Yeah. Yes,
yes,
Dr.
the case itself is not about steroid complications. It is about breaking the news and explaining the disease and etc.
Yes, so
I
the
forget.
management will
I,
be, the management
sorry, I
is
forget
steroid.
to explain about the complications of the disease. That if we will not treat, you can develop infections, and we will give you some antibiotics. And if we will not treat, there is some proteins or loss in the urine, which we called antithrombin proteins, and so we will
Yes,
give you anti blood thinning medicines. And
yes,
we and in your disease, you can have increased level of the lipids, so we will also give you some lipid lowering medicine. I think I forget this. This should also
yeah,
be mentioned.
yes, you're right. And also, you can mention about the possibility in the future to have a flare up, and also
He
it might
he mentioned
be,
that, Dr. Hassan. He
he
mentioned
mentioned,
that.
yeah, the also the RRT, renal replacement, in some cases, but not common,
Yes, yes,
right?
yes, yes.
Okay, well done, Dr. Azhar. From my side, I don't have any comment else. If someone has comment, please,
Yeah,
you
yeah,
can
yeah,
share.
yeah. Yeah, yeah. Dr. Ashar, well done. But I have just one comment. This comment, just your voice, your tone. We need your tone to be very low, not like this. In exam, please don't do like this, okay? You need
Okay.
to decrease your tone. This is a very comment from the examiner about the tone. You need your tone to be, especially in breaking bad news.
Yes, during the sympathy
Okay?
and empathy. Yeah,
Yes.
yeah.
I was thinking that my voice is not clear, and Dr. Allah
No,
voice was not clear, so that he
no,
can hear me. That's why.
no,
You are
no.
right. You are right. Very good
Yes.
point. Very good.
Other than that, if the steroid is a task, and this is, I think, running in the scenario, the main target is to talk about the steroid. Here we'll mention, يعني when we talk about the steroid, we need to tell the patient without steroid, your condition will progress more and will afraid can affect your kidney, even to can lead to failure of your kidney. And with this steroid, your condition will become stable. And regarding the dose, we'll give you just the dose, just not to harm you, just to control your disease, like this. And even we need to mention a few side effects. The examiner will comment if you didn't mention about the side effect. At least to mention like this. And don't worry, we will give you a follow-up. This is my comment. Other than this, you're doing very good job.
Yes, thank you, Dr. Ali. Yes, I agree. You can mention
He
that
was
very,
asking me the duration of steroid treatment.
yeah, it's long time. It
So I
takes,
said
it
we
might,
will monitor you, and
perfect.
then we
Yes,
will
good
update
answer.
you.
Yeah, perfect, perfect answer, because it might reach to 6 months. This is what I read recently. So it takes long time, lasting months, not only weeks. It might be for months. Okay. This is the way also how to address the duration without specifying the duration, because you don't know. You are not nephrologist. Supposed to refer him and we can tell, but it will be for long time. And also another point, adding to the point of Dr. Ali, you have to tell him you have to be compliant, taking the medication regularly every day. Don't stop steroid abruptly for any reason. It might lead to serious complication and it might harm your life, which is, I mean, this is for us, which is Edison, but Edison in crisis, but you will not tell that. Just alarm him that he shouldn't stop it abruptly with no reason. Okay?
Okay. Okay.
Yes, okay. Dr. Ibrahim said yes about hyperlipidemia. He mentioned it later. Yes, assure him that you will have check on regularly and try to correct some side. Yes, of course. Follow up. I said group of specialists, specialized nurse. She will tell you how to, and of course the osteoporosis, gastric protection, the all other side effects. You can touch only the most common hypertension, high blood sugar, the weight gain. These are the most common, and you have to touch them either by mentioning, and you can say later on you will get a leaflet brochure about these side effects and how to protect them and how to take care of yourself. Okay, no, it's high dose cortisone. We should tell the truth. I am not sure about high dose. I remember it was zero point 0.5 or zero point 0.6 ml per kg, milligram per kg. So it might be like 60 or 50. I just read it today. It's not that high dose, like not like pulse therapy, not like 500 or more than this. It will be zero point 0.5 up to 1 milligram per kg. I just read it today, so it will not be that much high. 1 milligram per kg, so yeah, it's 70. It's not, I mean, compared to the pulse therapy, it's nothing. Pulse therapy 1 gram or more than 500, so it's not. But it will be, yes, compared to also to fibromyalgia rheumatica, it will be, sorry, polymyalgia. It will be high dose because for polymyalgia rheumatica, it will be 20 milligram daily. So it's in between. Long time, yes, it will take, it lasts, I think, months, maybe 6 months, and they reassess again, and so on. Thinning of the bone, it might put your bone, yeah, to broke easy. So we need to give you protective medicine, of course. Thank you, Mr. Sarah. Yeah, you have to give idea about the osteoporosis, the gastroprotection, the peptic ulcer, and the hypertension, high blood sugar, and the gaining weight, cataract, psychosis, all these, but don't go deep. If you have time, go through them. If you don't, this is not the main task. The main task, breaking bad news, explaining the disease. Okay, thank you, Dr. Ibrahim, Dr. Sarah. Any other comment? Thank you, Dr. Ala. Very nice performance, and Dr. Azhar as usual. But we have to thank Dr. Ala because this is first time for him.
Yes,
Anyone
yes.
interested, please, he can send me anytime to practice. Everyone will be most welcome. Okay. Thank you, everyone. Seems this is the scenarios for today. Any question before ending the session? To enjoy our weekend. Hopefully, we'll see you after weekend. Okay, thank you, everyone. See you after the weekend. Have a nice weekend. Good luck and goodbye. Assalamu alaikum wa rahmatullahi wa barakatuh.
Well,